Yeah, welcome to our healthcare webinar. Basically, we're just talking about customer support as a good tool. But before we get into that, I'll just do a brief introduction. So I am Sheyi Afolabi. I am the product manager for Curacell Claims, and my co-host here is Anita Jackson. Hi, Anita. You can just quickly say hi and introduce yourself.
Yes. Hi, everyone. My name is Anita Jackson. That's actually my surname. And no, I am not in the Jackson's vibe. I'm currently in the sales team, sales and business partnerships in Curacao. And ideally, my job is to make sure that everyone knows about Curacao and knows the benefits. I'll just be chipping in one or two and asking my own questions during this discussion. And I'm hoping we're going to have a good one, and most importantly, an insightful one where I also get to learn as well. Okay, over to you, Shay.
All right, thank you. So once again, welcome everyone. So we already know the topic or why we're actually here. So the goal of this event basically is to establish the role of customer support as a viable tool and a system that health insurers can use to drive business growth and using technology so they can efficiently scale, customer support and success efforts. Uh, I'll just be doing, like a brief intro on the health insurance industry. Mm. Well, apart from that, we'll also still be exploring critical roles that customer support plays, and then also maybe some difficulties that are being faced in the insurance industry generally. So, as we all know, the health insurance industry is rapidly evolving, and customer support has become a key factor for companies to differentiate themselves in a crowded marketplace. It's not enough for you to just be able to provide a solution if you don't have the right customer support system that would help you to drive that your product or help to increase your customer retention. There might be a problem with you being able to scale in whatever chosen business area, which in this aspect we're talking of the health insurance industry. And we all know that word of mouth goes a long way in also selling out whatever it is, whatever kind of service you are providing. And if you don't have the right customer support, someone that your clients or your customers can reach out to immediately they have an issue, they start to spread the word that whatever service you're offering, no matter how awesome it is, there's an issue with them being able to resolve issues time rather. Yeah. So in emerging markets like Africa, where penetration of health insurance is low, um, we just know that customer support is even that it's very critical. It's something that you cannot do without, no matter how awesome whatever service you are providing is. But before we go right in, we had already introduced ourselves, Anita and I, product manager, and then the sales manager on the claims products. I'll just talk a little bit about Curacell and then we can get started. So Curacell came about from the challenges that we've noticed with processing of claims in the health insurance industry. We know processing of claims involves a lot of tasks that require, efficiency and accurate handling to ensure customer satisfaction and also minimize fraud. And normally it would have been through a manual process. You have to submit the claims, and then that is usually time consuming. And even dealing with those paper claims are also prone to errors, which could lead to delays and then increased cost as well, because you are also trying to get more hands to get the job done faster. And then when there are errors, you have to pay for those kind of mistakes that are being made. So we have the Curacell claim system that solves all these problems, that allows insurers to easily collect claims and process them. And we also have our detection system that uses artificial intelligence to identify potentially fraudulent claims. Okay, so Anita, I'll just let you get right into introducing our speakers, and then we can get right into the business of the day.
Thank you, Shay. Thank you, Shay. Nice one. Just want to quickly introduce our speakers to the attendees and also welcome the attendees as well. I can see that there are on the line currently and more joining in. So without further ado, I want to welcome everyone, speakers, attendees alike. Like Shay has said, today we will be speaking with our top healthcare leaders in the industry. And we'll be talking on the opportunities in the technological space and how we can leverage, how we can use the technology to leverage customer satisfaction. And like our host said, customer satisfaction is always paramount. And so we are going to have a discussion revolved around that topic. So we're excited to have with us Dr. Tinu. You can also say hi, or you can wave, or anything that you'd like to do. Dr. Lola, Dr. Taiwo, and not sure Ibor is on the line. Well, if she is, welcome. Thank you so much for joining us. We are enthused to have you here, as you can tell from our smiling faces. Okay, so I'm just going to dive right into the question so that we can get started. For attendees, just in case you have any question, like if you check on your computer or on your phone, whatever device that you're joining on, you'd see at the at the bottom bar of your phone or your computer or your tab or whatever device, you see a Q&A there. You can leave your question. If you have a question in particular for any of our speakers, there's Dr. Tinuola, there's Dr. Taiwo, there's Dr. Lola, and there's Iboro. If you have anyone specified, you can specify their names as well. If you have anyone in particular, and if you don't, you can just drop it and it can be generalized. Thank you. So let's just dive right into the questions. Okay. My first question will probably be from the top, and it will be to Dr. Tinola. This question will be to you. What do you think, in 2023, we've gone like 3 months now. This is the first quarter. What are currently like one of the top 3 healthcare challenges you can see in the health insurance industry? And what do you think will probably be solutions? Because most times when we see like problems, we already know, like we already have an attached solution in our heads. So what do you think will be the solutions to those problems that you are currently noticing or you can currently see right now in the healthcare industry? Okay.
Thank you for having me here today. I mean, the health insurance industry in Nigeria is, I would say it's mature, but it's been around for a while. But there's still a number of problems that persist. I think the obvious problem or the obvious challenge we have is low coverage. The percentage of people that have health insurance who are registered on any scheme is quite low. I mean, the percentage is arguable, so we'll get into that. But obviously, we have 10% registered with any type of insurance, public insurance, private insurance. So it has to be improved. I mean, with the recent passage of the health insurance law, with the establishment of the Nigeria National Health Insurance Authority, which now makes health insurance mandatory, we hope that once this is implemented, we should see an increase, in that. Also, lack of trust generally. Nigerians don't really trust the insurance sector. You have a lot of companies that have not fulfilled their obligations. So there's a general lack of trust in institutions, and then particularly in the insurance institutions. Also, you have inefficient claims processing. A lot of claims processing is still being done manually. You would have thought that that would have been automated by now, or you find out that a lot of HMOs don't use a codified claims processing system. So ideally, you'd have, even if it was ICD-9, which is still fine, you'd have a codified system so that the claims are automated and technology can come in to move the claims, very efficiently. But instead, you have people dealing with the claims manually. So if someone had a good day, he could vet the claims properly. If he had a bad day or he hasn't had lunch, so there's so many variables and so many factors that affect that. So what should be efficient and it should be automated is being done manually. So, I mean, the obvious solutions with the passage of the law, the NHI is working on implementation. Once that rolls out, we will be able to see more coverage, have some type of basic plan, and then, I mean, automation of the claims process is, for me, fundamental. And then general education and awareness so that people have more trust in the system. Thank you.
Yes.
Over.
Yes. Thank you so much. That was quite an interesting answer, actually. One would think that, because I think you said your first response was the low coverage of health insurance, and it baffles me because I'm like, we just came out from a pandemic, right? And it's not even totally over yet because it's still ravaging some countries. And one would think that everyone would now have health insurance. I mean, no one wants to have that kind of scare anymore. And I think it brings me to the next question, actually. If you look back at the pandemic year and even moving forward, I think that a lot of people visited the hospital. A lot of people were, assessing their health insurance. That kind of a thing has to have an impact on health insurance, on the health insurance industry. Do you think that, what was the impact? I think there will be two questions from this one. One, obviously it had a negative impact. Do you think, what was the impact, and how do you think it affected the health insurance industry? Do you think that from that kind of a pandemic, it might bring some sort of, oh, voila, I can now have a health insurance, or I should really have a health insurance because, I mean, it's going to do something. I mean, next time, maybe if there's a pandemic, it's going to help or something. I just wanted you to shed more light on the COVID-19 and how it impacted the health insurance industry and even patients at large.
Okay. So I'd say the pandemic really put health on the front burner. A lot of people didn't understand the importance of health or the significance of health to the workforce or human capital development. So the pandemic is a once in a lifetime, in fact, once in a couple of generations event type of thing that makes everybody have like a reset. So health is now at the forefront. So that's one good thing that came out of the pandemic. People are now more focused on health. I think secondly, there has been perhaps it's paradoxical, there's been an increase in health insurance demand, but I don't think the sector has been able to take advantage of that by offering enough credible options for people to select from. So our market is still a little basic. You should be able to have like a PBM. I want to purchase a pharmacy benefits type of plan only. I want to purchase travel health only. I want to have basic cover only. So we still don't have enough options for people to select from, although there has been an increased demand. With the advent of the BHCPF fund, the Basic Healthcare Provision Fund, it's likely that we will come up with some type of basic package, and then everybody can be mandated to have the basic package, and then you can buy like a top-up plans that have additional ancillary benefits. Also, we've had a claims. So globally, the changes in the policy requirements have changed. So you find a lot of people now reject certain categories of people. I mean, I've been told of cases where doctors have been denied health insurance because of the likelihood of them being exposed to COVID and dying. So there's been a rise in claims, and that has led to some policy adjustments globally. Not so much locally in Nigeria, but there are policy changes. So, I mean, telemedicine did arise. We had a few HMOs who were able to position themselves and partner with a few banks, a few other institutions, pension companies, and offer that to people. But that seems to have waned a bit once it was back to business as usual.
As usual.
Yes. So I think those are the impacts, the immediate impacts that I can see that the pandemic had on the health insurance sector. And well, globally, yes, I'd say that those are the immediate things I can see. Thank you.
Thank you so much.
All right. Thank you so much, Dr. Tino, for these insights. Just before we continue, I see someone has been trying to put up their hand. So we'll be taking questions in a bit, but for now, you can just leave whatever question you have. If you look at the bottom of maybe your tab or your phone or your laptop, you would see a couple of options. There's one with a question mark icon. That's for Q&A. So you can just click on that and drop your question. Or if you would want to unmute maybe much later, we could maybe after our speakers are done, maybe you could bring up your question. But just so you don't forget, so you can drop it in the Q&A box, if that's fine. Okay, welcome, Ibor. You weren't here when we started the introductions. Welcome, thank you for joining. Thank you for joining. Okay, thank you, Dr. Tino, again. So you raised a couple of points that I think we might still take a look into before we delve right into the customer support role that they play here. So you mentioned lack of trust, and for one of the reasons why insurance is still not, would I say, booming as expected. And I would use myself as an example. Maybe a couple of years back, I would wonder, like, why do I have to, like, why do I need health insurance? I mean, I'm very healthy. I stay for the whole year, and maybe the only thing I need insurance for is basic malaria drugs, or maybe if I need to use painkillers. So I always used to tell myself, like, why do I need to do a full-blown insurance when I obviously will not need the rest of the packages or the benefits that I'm paying for? And what happens to all this money I'm paying? So it's just like you said, a lot of people have that trust problem, and then there's the confidence in the insurance system. So my question would now be probably to Dr. Lola. Let me see. So it would be for someone who was in the kind of headspace that I was as at then, someone that is seeing the importance of health insurance, what would you advise maybe people on the call or just anyone for the kind of insurance plan you think they should come up with? Or are there flexible insurance plans that people can actually, like, be on that will not discourage you from saying, I don't need this package, I don't need that package? Are there things like that available?
Well, yes, there are such things available. So ideally, you should be able to sort of mix and match, select, the benefits of an health insurance plan that you want. Although it does depend from one health insurance company to the other, what flexibility are allowed. But then there are introductory plans that they can, start with. All right. One thing that we have been trying to do is to have introductory plans for people who have not had health insurance before, just get them used to the concept of health insurance that caters directly to treatment of malaria and simple infections, that can cover them in terms of accidents and emergencies, that can cover them in antenatal care and delivery, if required. Now, these are very simple plans. So that's one way to start. Another thing that is being introduced across health insurance companies is flexible payment. Now, typically, health insurance policies are annual policies, all right? But with the introduction of flexible payments, they may be able to pay, on a monthly basis or a quarterly basis. Although it's still an annual policy, just that the benefits will then be graduated, so that if you are consistent in payment, then you can then access increased benefits, as you go on along. But generally, people should consider their family history. Now, as a young person, you probably are fine now. You're in top shape. You're, very active and all. But if you look at your family history, if there are instances or history of healthcare challenges that are probably familial or genetic in nature, there's a possibility that down the line it may come to you. And so while the person may not have to use that in the current time, it's possible that down the line they may have to, be treated for such things, and then they will need health insurance. Now, if you have been consistent with a health insurance company, you will not be in quote bounced when you need to access that kind of benefit. You will, get, because they have looked at the one thing that is done is a risk assessment. Look at your risk profile and see, how much of your benefits you're going to utilize. So it's not just for now; it's the futuristic look to it, right? And then in the interim, we also have access to wellness benefits, right? Going to the gym, using the spa. There's dental care, optical care. Those are things that you don't necessarily have to be sick to utilize. Now, these are things that can be costly, right? But if you have health insurance, there are benefits that the health insurance will help you to get, and you don't have to lose a chunk of your money just to get access to good dental care or good optical care. In case of pregnancy, which is not a disease, but it's just a part of life, right? So pregnancy, delivery, those are things that health insurance helps to cover. Maternity benefits, right? You don't have to be sick to access those. It's just part of life, and it's something that you have to use. All right, so the things to consider: healthcare challenges, family history, what your family structure is. If you're a young person just starting out and you're just getting married, it's good to put your new family on a plan, or even just yourself to start with, with the benefits I mentioned earlier on. So that's what I would tell someone that has never used health insurance before. The benefits outweigh the pros outweigh the cons, so to say. You pay a small amount, in quotes, a small premium for a large set of benefits, and no one knows when anything can happen. Emergencies happen, and then you need care immediately. What if you don't have money then? What would you do? Right? But your health insurance covers you for that.
I'd say this is Shei's time to get a health insurance, don't you think?
What makes you think I don't already have one? Of course I do. And I said that was like way back. And just like she said, I think the problem might just be the fact that people are not aware. A lot of people are still not aware that these are the opportunities that are open to them. People still have the old mentality of what insurance used to be like right now. So I think there's still a whole lot to do to bridge that gap and to create awareness for people to know that, like she just mentioned, you have gym. I'm sure if a lot of young people,
particularly interested in that.
people know that there are insurance plans that covers, gym,
Covered,
like that.
yes.
I'm sure a lot of people will jump on it. So okay, I'll just go right into the next question so we don't deviate too much from our main topic. So like we earlier mentioned, we're still here to talk about the role that customer support plays here. And I think I'll be directing this to Dr. Taiwo. So Dr. Taiwo, still on the customer support end now. How do you ensure that customers are satisfied with the service that they receive when they contact your company? Because with the way we've looked at it now, with COVID-19 and a lot of people being aware of how important health is right now, and maybe reasons why they need to get insurance, a lot of people will probably now be going to a lot of all these health companies to check out their website, contact their customer support system or services rather, and make a lot of inquiries. So how do you ensure that customers are satisfied? Is there like a laid out rule of things that the customers get whenever they contact the support system or the support staff? Do they also get maybe like a breakdown of benefits that they tend to get if they sign up on with your company to get an insurance plan?
All right, thank you for that question. You're very right in terms of the fact that we need to definitely explain to clients what they are signing up for, because that's one of the things that would influence, client satisfaction and client enjoyment of the plan. So if the client is not aware of what he's signing up for, you start having a lot of dissatisfaction occurring. And so, rules that are laid down, when a client comes on board and signs up, these processes where you have a session with that client, explain the certain benefits that are available. There also has to be a form of training and education of those that are, taking, that training. That's the customer support people or even the customer care people. Because at the end of the day, just like she said, the first speaker said, building that trust between the client and the insurance, it falls really on the customer support arm, right? When I'm able to call and the response I'm getting is making me comfortable with the plan I'm about to buy. Every question that I'm asking is being answered. So once the customer support can build that relationship, at the end of the day, the customer support must also know, what he is doing. You don't want a situation where a client is asking some certain questions and you don't have answers for it. So they have to be trained, they have to be educated, they have to know the know-how of how the insurance system, works. And then after that, they also have to have this, this human influence to it. I know that we want to introduce technology here and there to make sure people are, taking up these plans, but we cannot at the same time remove, the importance of the human feel to it. So when I call a particular insurance company and I hear human being on if we even notice sometimes when you want to reach maybe a network service and they have all these self-service options, you will still wait
operators.
till you speak to that. You want to hear that person's voice because you're like, no. I know the machine can do it, but I feel like I'll get a better response from a human being. So that empathy part, because at the end of the day, we are dealing with health. And sometimes people buy insurance plan out of fear, right? So if I don't want to die tomorrow, and with the whole COVID-19 thing, like you mentioned earlier, the whole scare might have pushed people to, buy health insurance. So it is necessary that the customer support or the customer service agent is able to, allay this person's fear, explain properly, let them know their benefits, and make sure that they are in a particular place where once they make that decision to purchase, a health plan, they are happy with it. I think it's just really the relationship between the support, and the clients. Being able to establish that rapport will definitely help very much in uptake of insurance.
Okay, thank you for that. Thank you. Okay, let's see. So from what you said, it kind of led me to something else. So it's okay for you to be, how would I put it now? It's okay for you to actually know like the steps or what the customer success team guys are supposed to tell clients when they reach out to your company. Well, I think this next question will be directed to Iporo. So how do you measure your customer satisfaction, or how do you know, is there a way you measure to see that the customer support is actually delivering on their end? And how do you use this data from after you've gotten what you think you should get from them, how do you use this data to improve your service quality on the customer service end?
Okay, thanks so much for the question. Good afternoon. Good morning, everyone. Sorry, I've been in and out. Well, the truth is, for us, we typically run an after-call survey to be able to engage those that have visited hospitals and have to make use of our services, to be able to identify how well we've done. If on the HMO end, there are things we need to do. And if on the hospital end also, there are things the hospital needs to improve on. Bearing in mind that we are the middle person between the hospital and the client. So once such feedback is gotten, we're able to engage the hospital if there's a complaint. And for us in-house, we're able to then improve on our services where complaints are gotten. So we have the after call survey, then we have our CSAT and NPS surveys also. Then one thing we do regularly is to also visit our clients to have one-on-one. The last speaker spoke about the one-on-one touch, really, in as much as we might have a self-service platform to be able to have for people who call in to move from step 1 to step 2. Having a one-on-one conversation with people goes a long way. Some individuals realize that can't be bothered with carrying out an aftercare survey online and would rather get that feedback directly from them. So regularly we have this engagement with clients so that we're able to get tangible feedback and then improve on them. Of course, one way we know that we're doing well is when we get referrals. We hear HR to tell you, okay, my staff are fine with your service, and then, oh, I have another HR who's looking to sign up a HMO. So I think that's the major way for us to know that we're doing very well. So referrals gotten from HRs, referrals gotten from enrollees directly also shows us that we're doing very well. So yeah, that's it.
Exactly. I would agree on that referrals part, because I think it's a way for you to know where you are, or how would I put it now, where you are at the heart of someone. Because if you are asking people if they will be willing to recommend your services to someone else, it means you've made quite an impression on them, and they are willing to vouch for you to tell someone else that this product or this service that I use, I can tell you for a fact that I enjoyed, or I am enjoying what I'm getting, and I would recommend, their services or their products for you, your company, or you as a personal, as an individual. Yeah, absolutely. Hi Anita, do you have any other more questions around customer support? I was thinking we could still ask Dr. Tunu and last something around that end as well.
Actually, there was something Ibero said that caught my attention. I was hoping to quickly ask her before, we jump to I'm really, I'm always very interested in client satisfaction, customer satisfaction, and how maybe they stay afterwards, because I think that that's actually the basis for a business, and I think that your experience is around that area. I think when you were speaking, you said something about running an after-test survey to know how well you've done, or how well the providers or the insurers have also done. And I was actually quite, I was wondering, those surveys, I think I'd have to go from where I'm coming from. I think where I'm coming from is the issue of pricing, right? It's a very, very dicey issue. It's the issue of pricing. Why I'm saying that is because I've had family members who I'm like, let me do health insurance for you now. Are you on a health insurance? They'll be like, that's it, money. No, not get money for that one, no. And that's the first thing they that's the first thing they say. And I'm like, it's not that expensive. We can find the one like So like how do you solve for the issue of pricing, especially with to balance your client's pocket and the healthcare financing? Because maybe I might be offering to give you 1,000 naira for example. I want to give you 1,000 naira because that is what I have, and I want to be covered in malaria, pregnancy, cancer. I want to be covered everywhere. I want to be covered everywhere. So, and that cannot finance the health insurance industry. 1,000 naira, or again, 1,000 naira is an instance. That amount of money cannot finance the healthcare industry. The insurance industry. How then do you balance my needs and the health insurance finances? I don't know if you understood the question.
Is this directed to me?
Yes. Yes.
Okay. All right. You've painted a very typical scenario. Really, pricing is a challenge for those of us in the health insurance industry, particularly because of what you said, trying to satisfy the needs of individuals. But one thing we try to do is to have different plans that would definitely be able to cater to the needs um, of everybody. I would speak from the perspective of the health insurance am familiar with. Again, we realize that it's not everybody that has access to health insurance. You know, most people have access to it because they work in a corporate organization and their HRs or the organization adds this as a benefit. So one of the things we try to do in recent times is look into the retail space where you're looking at people who don't work in a corporate environment, maybe entrepreneurs, or you have your typical market person. And one thing that we try to do is to try and meet be in a middle, should I use the word middle ground, trying to marry the needs of the expectations of an individual to what the health insurance will be able to cover. So in trying to meet that need, what we've also done is to be able to have different categories of plans so that you'll be able to find at least one plan that will fit into your pocket size. Let me use that word. So yes, it's tough, it's difficult. You still have conversations of saying, oh, but this doesn't cover this doesn't cover that. Overall, generally, it is managed care anyway. Managed care means not everything is going to be covered, but you have limits. So in trying to ensure that everybody is relatively satisfied, the pricing is done is carried out well to be able to cover everyone basically. We might not be able to get 100%, and I think like the first speaker spoke on, health insurance is still not widely accepted. Besides the part of pricing, they have this mindset as of saying, "Oh, God forbid, it's not going to happen to me." So we still have that mindset about God forbid, this is not happening to me. I'm covered by the blood of Jesus, and a whole lot of things. So until we have everybody coming under the understanding that look, health is very important. Yes, COVID-19 pushed that to the forefront, but you still have. I mean, a lot of us knew what happened in COVID-19. Some people still refuse to get vaccinated. Some people refuse to accept that it was a real thing and all. So getting out of that notion and understanding the fact that health insurance is very important. Health is important, until we are able to cover that, we still have this whole pricing thing. Even if you get it as low as 1,000 naira, because I know some HMOs have plans as low as 1,000 naira. Some people will still tell you it's too expensive when I can go and buy, So it's a challenge, but bit by bit, we're getting there, particularly with the NHIA Act, where it says all employers have to at least give some sort of benefit to their staff. We're hoping we would be able to jump over or resolve the whole pricing thing, when it comes to health insurance. Thank you.
Thank you very much for that. So, Dr. Taiwo, we still dwelling around, customer support and all of that. My question would be, how do you handle, difficult or complex customer inquiries? We have people that would call, and when you even tell them, as much as you try to tell them, the kind of plans that you have available, some people just ask so many questions that at that point you don't even have like a direct answer to give. I don't know how do you handle those kind of situations? Do you tell them, you give them a call back? Do you have like a process? You have a way you manage difficult questions that come in from clients?
Oh, well, first off, when you start having questions coming like that means there's been a gap between the client's education and what it really is. And if we try to reduce that gap where the education of the client, they know exactly what they're signing up for, those kind of difficult questions would reduce, right? Because if I know what is happening with my plan, when something is like she said, there's a limit. Some of these people don't know that when we say covered, is really to a certain limit. The cost of care is increasing every day. So that education part is one of the major ways we can, even tackle that in those difficult clients that will come in. But in the case of when the calls do come in, because I will not lie to you, they do come in, and they come in with such aggression, such anger, right? That you are stealing my money again, the trust aspect.
Oh.
Also, is the customer, yes, so it's the customer's support duty to first of all calm the person down, because the person is health again. And most people are coming with that aggression because they are really worried, right? They are thinking, oh, I'm not going to be able to pay for my health care, my child is going to die, or so on and so forth. So first things first that we advise our customer support is you have to understand that this is health, and you have to come from an empathic, approach to these questions. And then once you calm the person down and assure the person, again building trust, assure the person that I'm here for you and I'll answer every of your questions. You tackle the questions one by one, right? But so there is usually after a certain period, we kind of analyze all the difficult questions we get in a period, and sit back as a team, see where we can solve those issues, because sometimes you see that some of these questions, they come up over and over again, different people, but the same kind of questions. So after like a month or two, put together all those questions and see where the problem is, so that when recurrent ones, when the new ones start coming up, the agents are more prepared to handle those questions. But in the case where this is a new thing, the agent is not aware of what to do, of course, putting a call back might be necessary, especially where we don't want a situation where an agent is telling the client something false, because that will even further damage the trust that we're trying to build in this client. So every client or every enrollee, as the case may be, is peculiar. And that's why the customer support has to be properly trained, so that when you come across those difficult people, you ask yourself, how do I handle this situation? Do I give this person a call back after more information? And there are also guidelines that all of this customer support will have, depending on the queries that are coming in. Okay, if the person is asking for a certain support, that you're going to go and check the person's plan, explain to the person that this is what's accessible, maybe explain that there's a form of concession that we can give. So really it's peculiar to the person, and again it boils down to the education of the client and the proper training of the customer support. So it is necessary that HMOs know that you don't just take anybody from the street and say, oh, come and be my customer support agent. The person must be empathetic, the person must know what he's really here for. That's how I like to answer that question.
Okay. Thank you for that. So I'm going to pick on something you said. You talked about training, and it's not a hidden fact that a lot of times the customer support system or the customer support group, or the team rather, can sometimes be overlooked. You have training budgets for just not even just in the health insurance health insurance company rather, customer support in general in other industries. It's almost like it's just something that anybody can do, and a lot of times they are overlooked and they don't have proper training. They just feel if you can communicate, that's enough for you. You can just come on board and become a customer support representative. So Dr. Tinu, my question will be for you. So are there training and development opportunities available to help the customer service representatives to improve their skills and their knowledge? So they actually, because a lot of these things that they do, even the art of communicating, it's something that people have to be trained on, how to resolve issues or things like that. It's not just something that you feel everybody's born with. You actually need some sort of expertise in that area.
Thank you for that question. And I just want to thank Dr. Taiwo. I think she just spoke, for the depth in which she answered that question. I mean, I love the fact that she started out by saying difficult questions and not just difficult customers. So in my experience, I find that I think a mistake a number of agents make, they do not realize that the marketers, the sales agents that actually go out and sell the plans, make a lot of promises and tell a lot of tales in a bid to sell their products. So I think it's important, once a client comes on board, apart from the onboarding session, establish like a customer service representative or account officer that handles that client. Because you find a lot of times when people call in or their first port of call is the person that they're familiar with, which is the salesperson. And a lot of times that person doesn't have the right information, or they made up a story just so that they could make some sales. So it's important to even ensure that there's a transition from engaging with the salesperson to engaging with a customer service person as early as possible. Also, there should be some degree of transparency. You have where, depending on the sales agent you spoke to, it depends. So I always prefer, usually you have a formal way to contact the client. So even if you discuss something with the client on the phone, I mean, depending on the time of the day or whether the phone connection was bad, you could say something, the client could hear something else. So it's always good to have a documented follow-up to a client's questions, either by email or a letter or something, so that there's actually a documentation. Because a lot of the instances where you have friction is where someone says you said this and the person says no, that's not what I said, you misunderstood.
Yeah.
So I mean, I think she gave an excellent answer. That's Dr. Taiwo. In terms of training, obviously there's so much of training, but as you said, I think the first thing is you can't train someone who is not naturally empathetic to become so. So even as part of your recruitment process, some people are naturally warm. You speak to them, you're happy to engage with them. Those are the sorts of individuals that you need to hire for that role. So if you have someone who is good on paper, but for whatever reason the person doesn't come across as warm or effusive, that person may not necessarily get along well in a client-facing role. So for such people, I wouldn't call it a personality test, but I mean, there's a way you can evaluate someone. Are they warm? Are they easy to relate to? Do they smile a lot? Anybody can be trained. But if you don't have the baseline components required for training, it just becomes that much harder. A key thing I also think it should be emphasized to customer service personnel is de-escalating situations. I've always maintained, I mean, when I was actively working with people in that role, you have to understand that this is not an amusement park, this is not a disco, this is not some fun activity. The average person that is calling you is already feeling unwell. And for most of us, when you're not feeling well, you're not at that's not when you'll be most polite. You understand? So you have to train the customer service agent to understand that people will be rude. If you ask the average pregnant woman who's had a delivery, well, speaking for myself anyway, and most of my friends, they tell you that when they were in delivery, they cussed out everybody in the delivery room. Everybody, doctor, husband. Yeah, because you're not at that point, you're focused on your own pain, necessarily being polite. So customer service agents have to have a thick skin and understand that look, it's not personally about me. She's not giving me an attitude, or he's not giving me an attitude.
Yeah.
It's just the situation they're going through right now. I mean, but also I tell people all the time that training is, you can train me all you want, but if I'm talking to you on the phone and I already have a tone, even though you can't see me, the tone is transmitted through the phone. I could be rolling my eyes. You can't see me, but you're getting the message that I'm irritated, I'm tired, I'm just waiting for you to get off the phone. So people need to understand that there are little things, nuances that you think do not translate in a verbal communication, but they do. So your volume, your tone, your microaggression. We all know how to be passive aggressive if we need to be or if we want to be, but it's not productive on either side. So you see agents trying to score points. That woman, I showed her, I showed her pictures. How she was talking to me, but that's not the point. You're
my goodness.
ultimately driving away your clients. So there's a way you can talk to someone, even though you're giving them in quote, negative message or declining cover. But the way you talk to them, the tone in which you take, oh, madam, I understand what you're saying, but unfortunately, the terms of our cover. However, I suggest, you know, they get the same message, but they don't go away really angry. You understand? So that training is available, customer service excellence, but really your agents need to care. You know, I had an agent once who was excellent. Even he would call the patients, you know, on his own, with his own phone, his own airtime, whatever, and follow up and make sure that, oh, are you satisfied? Were you okay? Was the situation resolved? Type of thing. So you need people who are willing to go the extra mile, you know, within the ambits of what is considered legal, of course. So yeah, I think that's it. Thank you.
Emphasis on legal. So go and say you want to check on me, and then you are turning it into a stalker situation. So yeah,
Shooting their
I
shot.
like what you said. I'm telling you, I like what Dr. Tinu said about, you know, being able to de-escalate, because back when I used to work in customer support in a different sector, and I know how that can be, because the way you answer a call or a client issue can help to even make them even, you know, angrier, or it could help
Mhm.
to de-escalate the situation even if you've not solved the problem. Because there's a way you could just pick up the call and say, hi, good morning, and person say, what is wrong with you people? And then they are just shouting on the phone, and that's not the time to say, calm down, calm down. You keep quiet, because if I'm shouting and you're telling me to calm down, like, why are you telling me to calm down? Do you know what is wrong with me? Like, there's just that whole art of you being able to relax, listen to what they say, and know when to say the right things. So Dr. Lola, I don't know. So like I mentioned, I used to, you know, be in customer support as well. And what we used to do then, there used to be quality call checks. So they would listen into your calls sometimes, or you just see someone, you know, trying to supervise the way you handle even your mails. When you send mails, you could see someone who flag the mail and say your mail is sounding hostile. So I don't know if you do things like that that helps you, you know, monitor the kind of calls, the conversations that go on with the customer service system, or if you monitor the mail, if there's a tone in their mail, maybe there's even a format of how to even reply mails, because we had something like that. We actually did. So I don't know. Is that the situation as well?
Well, yes. So yes, there are scripts, right, for frequently asked questions and, you know, frequently encountered issues, right?
Okay.
Obviously, sometimes not word for word, especially if you're in a conversation, so it doesn't sound like you're giving a robotic message. But there's a human conversational element to it, right? Yes, calls are recorded, and there are quality assurance engagements on it, right? So listen to calls, you know, pick samples, and then engage the team on, you know, what could have gone better in this call. How else could we have, you know, handled this? You know, how would you de-escalate this? And of course, there are role plays as well, you know, during training sessions. Say, oh, in a scenario where this happens, how do you respond? When this occurs, how do you respond? But I also think that it's also important to manage, you know, beyond managing the clients, you know, also to manage the customer care agents. There are limits, right? People get to the end of their rope sometimes, especially if they've had to engage with people all day. People get overstimulated, you know, or get tired after a while. So it's important to pace calls assigned to customer care agents, you know, have a limit to how much calls they can answer, have them work in shifts so that they're also able to manage themselves. You know, there has to be a way for you to manage yourself to be able to manage other people. So if you're on your own, you're agitated or you're hungry, you know, there's a way you can come across, even if you had the best intentions. Again, it's depending on the situation, like the example that was given of a pregnant woman, right? So it's on both sides. Now, the customer care agent is supposed to be professional, but they also should be able to distress. So managing their time as well, you know, managing their emotions as well per time also helps, that kind of situation. But yes, there are engagements, and there should be engagements from time to time to be able to, you know, manage situations as they occur. And we learn every day. So there are typical situations that occur all the time, but there are outliers that maybe, you don't see often. And then those kind of situations can come across, and then sometimes people can be at a loss. All right. So which is important, which is why it's important to engage everyone as frequently as possible, keep up with trainings, and also that even if it's something that you don't have a script for, you're able to on the go quickly resolve the customer's issues. Healthcare is pretty emotional. So it's important to be able to manage situations well.
Oh, thank you for that. It actually is. I mean, I'm just trying to think of a lot of case scenarios where someone is being stuck at the hospital and they're telling you they can't log into this or log into that, and I'm trying to call my HMO and somebody is just talking to me anyhow on the call or just telling me calm down. I'm like, my son is hanging by a thread here. You're telling me to calm down. Can you resolve this as soon as possible? Okay. We had a couple of hands during our discussions. Olawumi and Oluwaseun. I tried to drop a message in the Q&A chat box. I don't know if you can drop your questions there so we can have our speakers answer. Or I don't know if something is still here. If we can get them to talk as well, if they're having difficulty. If you check at the bottom of your I don't know if you're using a tab or a phone, but where you have your menu, you see a series of options from where you can mute and unmute or turn on your video and all of that. You would see an icon that has like a question mark. That's where you have the Q&A. So you could just click on that, and you should be able to drop a question in there. I don't know if they can hear me. You can just type in the chat box. I don't know if you can hear me.
I think that if they can hear you, can just use the raise hand button that you used before.
Okay, yeah, you can do that.
Then while Samson tries to get them to talk, if they want to. Ooh, I think that's when Dr. Lola was talking. I think there was a particular statement that she said that caught my attention. Something about healthcare being emotional. And I think the witty part of it said in my head, like, oh, healthcare is emotional. And then it said Dr. Lola 2023. Dr. Lola, if you some research.
What a quote.
Oh my goodness.
You can use that as a tagline.
Yeah, in a research work, healthcare.
But it's what everybody has said, actually. Other people have said, I think the word other people have used is empathy, right?
Yeah.
For empathy also has to do with emotions. So, okay, if I do give a scenario, the scenario is of someone who is very hungry and needs to get food at a restaurant and they're delaying the person. It's almost akin to someone who has an ill child, or they themselves are unwell and they're at the hospital and there is a delay. Obviously, they are going to get angry. I think the word for someone who is hungry and angry is hungry, right? It's like they are so emotional and they can, burst up, and all they just need is food, right? The way that the front desk person would attend to someone with an ill child can calm before they even see the doctor, can calm the mother down in a way that they are able to first of all regulate themselves, right? So it's emotional. It's also why people would rather touch and feel, right? And why there is a preference for in-person consultations compared to telemedicine, because I want to see the doctor that wants to attend to me. I want him to see what I'm going through, right? All right. So healthcare is still pretty traditional, and there's an emotional element to it. And when you look at people's feedback for healthcare encounters are usually in extremes. They're either very happy with you or they're
Yeah.
very angry with you. You rarely find middle points. They are few and far between, right? So if you've done well, they will say, thank you so much. I'm so very grateful. You have done this. You've been very, they'll be very effusive with their praises. But when you have done bad, right, they will be very, the other side of it. And it's be very clear. So it's in extremes. It's quite emotional.
We do
All
have some
right, so we
questions.
have one of the questions. Yeah, just one has come in and from Olawumi. We're already even going to dive into that aspect of this session. So the question is, what technology or platform should a prospective client look out for when selecting an HMO? Okay. Okay. So I'll just. Okay. So Dr. Tino, I think I'd like to hear from you, and I'll ask someone else again. So, what technology or platform should a prospective client look out for when selecting an HMO?
Thank you for the question. To be honest, I don't think there's any particular technology. Just ensure that the HMO does use technology and that most of their processes are not manual. So there are various softwares, various platforms that can be used. I think more importantly is looking at the track record of your HMO. You
Okay.
understand? Look at what it is they've done, do a survey. So what we do, for instance, we go to the hospitals where most of our staff and our teams go to and ask the hospitals themselves, which HMO would you recommend based on track record? They pay you on time, they provide the services,
Mhm.
they keep to their word, and then at least there's a major degree of automation. They're not stuck in the past type of thing. So I think that is a good factor. Also, transparency. Um, I keep emphasizing transparency because there are a lot of things that get shrouded in secrecy for no obvious reason. I think the more open an HMO is about what goes into the costs, we're all very realistic. We live in Nigeria. We understand the devaluation of the currency and the inflation and the effect that all these things have. So if you're open and you're honest about that and you say, well, your premiums have to rise or whatever, I think people are amenable to that. The issue is when there's secrecy and there's a lot of cloak and dagger type of thing, then the natural instinct is to assume that someone is hoodwinking you or fleecing you. And that's when you get the statement about you people taking my money type of thing. So
Mhm.
obviously also an HMO that has a fairly decent number of people. I mean, it's obvious economies of scale have to come in, so there have to be enough funds to actually pool so that the underwriting process makes sense, and then they actually have the might to be able to cross subsidize, which is what essentially health insurance is. Thank you.
Thank you for that. Okay, I'll still need one more person to just, I want to hear another thought or another aspect from that. Hi, Ibro, I'm coming to you. So I'd like to hear your thoughts on that. For the question that was asked as well. Is there something that you point at as a technology or platform that clients should look for when they're selecting a prospective HMO?
Okay. Well, Dr. Tilo has actually said this. There really is no platform to be for a prospective client. But like I previously said, a lot of people come on board through referral. You can decide to go the provider route, which is the hospital route, to ask, okay, which of the HMOs would you recommend based on based on the hospital's relationship with the HMO. But also, I know a lot of times HRs have their own separate platform, so most times they throw the question out there. So that would be the best way, really, because currently there's no platform that does that. So referral is one fantastic way, and then visiting the hospitals also to find out who really is transparent. Like she said, transparency, automation, lives that the HMO has, because that helps a lot. You're able to know that, okay, other organizations have been able to put their trust in this health insurer, and they're obviously delivering well. So that would be what I would suggest.
Okay, all right.
We are
Okay,
fading into the background.
my lights just went out. Welcome to Nigeria. Okay. Sorry about that. So while we're on the subject of technology, seems like our audience wants us to go into that. Maybe I have just one or two questions so we can, move right into rounding up. So my question would be on the side of technology, what are some of the key technology trends and innovations that are transforming the health insurance industries today, and how let me see, I think I'm directing this to Dr. Taiwo. So what are some of the key technology trends and innovations that you've noticed, like in the recent years now? It's like a lot of insurance moves and everything has been moving from, being way manual to, more tech inclined. Yeah. So how's your company keeping up with these changes? Yeah, I think that would just be my question.
Well, I think there are a lot, and technology is definitely taking over. Of course, we shouldn't forget that the human part is still necessary. But technology helps us to make things easier for both the HMO aspect and the client aspect. I think one way that we use technology is for this detection of fraud and abuse. Some things that oh, my lights have gone out too, so we're all on the same, same place. So I mean, one way that we use technology is for fraud detection and abuse, because at the end of the day, as much as we want to be compassionate with our clients, we can't take out the fact that some people can be mischievous and dubious. I want to cheat the system. So we also have to protect ourselves and protect other clients that don't even know that this is going on, and they will eventually feel the effects. Another technology that I think has come up of recent times, something that we've mentioned, which is the telemedicine. Reducing hospital visits has been a great impact to the health insurance society, because the money you are spending paying for a physical consultation for something as simple as maybe just a headache or even malaria, sometimes for telemedicine you just consult, see a doctor, right? Just like you're seeing me, I refer you to a hospital, to a lab for a particular test, and reducing waiting time and reducing hours spent waiting in the facility for you to even see a doctor. And then I do my test, I bring back my result to you, still on the telemedicine platform. And then, you prescribe medications. And then, I'm contacting pharmacies and saying, oh, I have this client that's going to come to your shop to pick up some medication. So I'm helping. I'm also helping the clients to make access to care easier. And that is in a way in which technology has come to support us and help us. And I think, in the future, I can just imagine what technology will come up with. Also, like mentioned in the from previous speaker, the claims processes, making it as transparent as possible. If it is being done by AI or by being vetted by the technology, there's reduced chance for errors. There's reduced chance for mistakes here and there that people can do when they are tired. And one major part that affects clients is this issue of reimbursement. For instance, most people are offended when they can't get their reimbursement on time. So HMOs will promise, oh, you get a reimbursement 2 to 3 days. But because it's manual in some places, and you have maybe 1,000 reimbursements to sort out, maybe through 3 or 4 people, it delays them, and that also affects the trust that the clients will have with the HMO. So technology coming into that place will help you vet all these things in time and make sure everybody is satisfied when it comes to reimbursement. But honestly, we can only begin to imagine what it would, eventually do for us in the future. But I think it's here to make things easier. Really. Yeah, thank you.
Okay. Thank you so much for that. Thank you. I think I still have one more question still revolving around technology. I think this will be going to Dr. Lola. So still on, we already know that technology is here to stay and is going to be influencing a lot of things. So my question would be, what challenges do you face when implementing new technology solutions? Like on our end, I know we have a couple of complaints sometimes from HMOs saying their providers are not ready to adapt to, the solution that is being provided. Some of them still just want to stick with that paper. It's like a lot of people, sometimes people don't know how to deal with change. So it's an issue that even when they have set them up on a software solution for them to, process their claims, you still have people still submitting claims manually. Even for pre-authorization requests, you still have people asking us to say, okay, maybe they would want like an inbuilt chat system so their providers can chat with them to request for pre-authorization codes, even when we have an auto generation system on our platform. So I'm just wondering, what other kind of challenges do you face and how do you overcome these obstacles?
Okay, just to clarify, your question is, with provider adoption of technology?
No, it just in general, like what challenges do you face implementing some of these new technology solutions? So I'll just give you an example of something that I feel might be there, because it's something that we have a couple of HMOs also complain about with their providers, how it's hard for them to get them to use a solution that they are providing. Some still want to stick with the manual methods. Either they want to send a mail to request for PA codes, or they would rather still, submit paper claims.
Oh, okay. One thing is, even though change is, the only constant thing, managing change is still hard. One of the things that you'd see is that there's probably not an effective and efficient change management process in place, for most people that are trying to either switch technology or, go from, paper to technology. Another thing that you'd also see is that there's probably a mismatch of data. So for example, the way that a facility or an organization has been keeping their data is not easily transferable to a working technology system, for example. There's probably no codification on my end, and then I want to move to a codified system. Okay, that's poses a problem. So until except it's projectized, and then someone is put on it, but there's a team working on it to make sure that the transition is effective. There might be challenges. Another thing that we have in this climate or in this environment is availability of devices and a working network system, and having people who are able to understand how to use the devices and the network, and who don't typically just balk at every small challenge and then just quickly revert to the status quo, but willing to see it through and make sure that I understand this. I don't know if that's clear enough. But yes, those are challenges. Another thing is staff attrition. Now you've trained one person who has eventually now gotten this very perfectly, and then the person has to leave the company, for instance, and there is no effective handover, and then you have to start training the new person again. All right, and there's a lot of staff attrition within the healthcare system. The Japa syndrome is also contributory to that. But again, that's another challenge that people would face. So yes, so those are some of the issues that face the adoption of technology.
Thank you, Dr. Lola. That was quite an interesting answer, coupled with the internet proving your point. um, but let's not forget that in as much as humans make mistakes, the technology also has one or two. But one thing that has not so far made a mistake for us should be AI, the artificial intelligence thing, where artificial intelligence is that thing that mimics the actual process and gives you exactly word for word, exactly what you are given to it. And so I think that AI thing is actually quite fascinating. The first time I heard that it was used for Netflix, in my head I was like, no wonder. I was wondering how it always showed me everything I liked. I was now thinking I was accustomed for me. Like I was like, oh, so that was the reason why. It was a new thing for me at the time, and I was super impressed. Um, bringing it down to where I currently work and what we currently do, so far so good. I remember when I joined my current company and I saw the AI thing also work as our vetting engine. When it worked, I was like, it had to be jazz. It had to be juju, some sort of thing. I was like, okay, run it again, we even had I think we even had some sort of testimonial saying and I wouldn't disclose the company who said so, but there was a review at some point that said, oh, we had like people working for us in the back end. We had people, actual doctors, just working for us. And, and it was funny because I remember laughing at it. They're like, no, I've actually seen this thing work. It was after a while that they got to trust our AI engine, and so far so good. It had been able to curb out fraud from the providers, and even make some level of transparency. They could see that, oh, this drug was for this person, it was for this reason. That is what technology has done so far, that has impressed me, especially in the insurance industry. I also like the fact that everyone agrees that claims processing could be a hassle. It's a hassle. I mean, I used to see stack of papers when I used to go to the hospital when I was younger. You see stack of papers, and I used to ask my mom, is that everybody that came to the hospital today? The stack of papers thing it's a hassle. I mean, I'm actually glad that has been taken care of, or at least that's coming to light, and people are trying to understand that, oh, there's the technology for this. We have made it our mission here at Curacell to make sure that there is no more, there should be no more papers. That's literally our mission. Make sure that there's no more papers. The automation process is easier. There can be transparency. People do not lose money, which is very essential. Money is essential. We can all agree. Nobody is losing money. The providers are not losing money. The insurance company is not losing money. And better still, the clients. I remember one of our speakers saying something about people like to be paid on time. Honestly, I like to be paid on time. If my money is supposed to come 26, I want to see 26. I like to be paid on time. So that has also curbed the technology has also helped for a good turnaround time. That's just quickly in a nutshell what Curacell does, and what technology as well does, not just Curacell. So there are other companies that do that. But I think that what I should highlight here most importantly is that here at Curacell, we use AI, that thing that makes Netflix look really good. uh, so that's that on my part. We are coming to an end. I don't want us to stay here for a very long time. I want to use this opportunity to thank the attendees that have been patiently waiting here with us. If you do have questions, please let's utilize this opportunity and ask our speakers in the house, because we cannot see them here again until another opportunity. So let's ask the women in the house our questions. If you have questions in regards to health insurance, you want to use a health insurance, just please put them in the box below. Ask questions. If you have anything to say in particular, you don't really need to ask questions. Maybe there was someone's comments that you found insightful. can also put it there. But yes, thank you so much for attending. We are glad to have you here. I mean, without you, there'll probably be no webinar. Also the speakers as well. Thank you so much for sitting in tight. Dr. Taiwo has been sitting in tight for a while now. The lights went for 2 seconds and came back. Dr. Lola, thank you so much. Dr. Tinu, thank you. Ibert, thank you so much. I love your glasses. Was going to ask after the webinar if I should come and take one. And to our host, which I'll be handing over to Shay. Thank you. I just talked about her and she dropped. Okay, Shay, are you still there? Hi, Shay.
I am. My network is it's
Oh,
seeming a bit spotty. Can you hear me?
Yes, I can. So we're just trying to, give an opportunity to the attendees just in case they have questions, so that they can just ask their questions quickly. I think we've maxed out on everything that we want to learn today from us. So we are hoping that, we'll have questions from one or two of our attendees.
Okay,
and if there's none,
I think.
if there's none, I can
Yeah,
hear
Anita.
myself. Hear me? Can
Yes,
everyone
we can
hear me?
hear you.
Oh,
Yes,
okay.
we can hear you.
Oh, please go ahead. Sorry.
Oh, okay. Sorry, I think I lost you when you were, doing the talk about Curacao. My network just went a bit spotty. But I'm sure you did. You did a bit of justice around that. Talking about the Curacao solution and how we're using AI to detect fraud with our vetting engine. How we have a couple of rules that are being set up. It could be we have a medical team, obviously, that works on that end. So we just have the team there that sets rules based on different medical parameters. It could be if you we know that they are setting what would I call it now, certain prescriptions that you can only give to male. There are some that are just restricted to female. There are some drugs that are for children. There are some that are for adults. We have different rules like that in different places. We also had to link that as well to plans and benefits. So it's really a robust thing, and we're still working on another version of that to make sure, just like we're trying to branch out into East Africa and other parts of Africa. We already know that there are rules that may apply in Nigeria that might not necessarily apply in Uganda or might not necessarily apply in Tanzania. So we're also looking at that aspect as well to make our vetting engine, customizable. So it's not just one rule that applies to everybody. You can customize according to your location. Because seeing like all the discovery calls we've had, we realized that a lot of things that we think are just restricted to Nigeria is obviously different when you go to another part of Africa. So, but yeah, I think that's just mostly about it. Thank you so much, everyone. Thank you, Dr. Taiwo. Thank you, Buru. Thank you, Dr. Lola. Thank you, Dr. Tinu. Thank you so much. And also thank you for the attendees. Thank you for listening. And thank you for all of the insightful conversations that we've had.
Actually, if I could just jump in. So we actually have one question, and the other one is nice.
Okay.
The other one is saying nice webinar, quite insightful. So thank you to our speakers for giving us insightful deep on healthcare and health insurance in general. So I'll just say the question and I'll throw it openly. Please, if you do have the answer, so that we could just go. The question says, hi, okay, I think the person means to say, how has
Okay.
ERP implementations been explored within the company to assist in internal processes? Can you share an experience? I just threw that question in the open. If if anyone has an answer. ERP implementations, how has it been explored within the company to assist in internal processes? So the internal processes within the insurance companies, is there any ERP implementation and has it been done? Is there an experience that we could share? I think that's just generally his or her question. I think it's an anonymous, I think.
If any of our speakers want to give a go at this, Dr. Lola, Dr. Tino.
Well, I don't currently work in an HMO, but obviously, if you have an enterprise resource platform in place, it streamlines the processes within any organization and makes it that much more seamless. So you have your finance, your claims payment, your HR functions, your customer service functions, all integrated seamlessly. And so I do know a few HMOs have um, implemented like a modified form of that, not a complete ERP system. And I think that is the gold standard generally to make things seamless, particularly running the call center, having some type of dashboard to resolve issues and still be able to keep tabs on the progress made. I don't know if that helps, but that's my response.
Just to add a little, most organizations, like Dr. Lola said, I mean Dr. Tino, sorry, like you just said, have platforms that are used to be able to track issues or complaints, challenges, or things that come up really, so that you have a team that actually checks to ensure that those things are being logged on. One very familiar one is CRM platform that is used to track things that might be logged on. So that's one way to ensure that our internal processes are smooth for using the CRM.
I mean, at the end of the day, the simpler your processes are as an HMO, it will definitely translate to how simple it is for your clients to be able to access care. If it's so complex, even at internally, you can imagine what you will put out. So definitely, ERP is something that I'm sure most HMOs are definitely looking at how to implement fully. I'm not sure it's been fully implemented yet, but it's definitely something that most people are looking, because at the end of the day, I want to deliver service, so I need to make my internal processes efficient enough to give me the time to think about more creative things, more things that I can do to interest my clients, that they will choose me instead of another person. But if I'm so focused on the complexities of my work, I won't have the time to even see what I can do as extra benefit for my clients. So it's definitely part of the technology that is coming up that would definitely assist and improve the system as a whole.
All right. Thank you so much, Dr. Taiwo. I mean, at the end of the day, like you said, the simpler the processes, the more efficient customer service. Thank you so much. At the end of the day, I think that in order for us to be able to choose a HMO, and that in order to get the best care, you have to look at their processes, right? Like, are they using something that would fast forward this to help me get better care from my patient, from my hospital, from my provider? Is their process good enough for me to trust? Because at the end of the day, it's trust that matters. Trust between you and trust between your healthcare provider, and even trust between your insurance company. So thank you so much to everyone, attendees, speakers alike. Very, very excited. I have learned a lot personally, and I think that everyone too on the call has. And so I'm really, really, really grateful for taking out the time of your day to come here. I mean, it's almost 2 hours. 2 hours of your time to come here. I'm super, super, super thankful. This comes to an end. I mean, the webinar comes to an end now. So we have to bring this to a close so that you can go on to the rest of your day. Thank you so much, Dr. Taiwo. Thank you so much, Dr. Lola. Thank you so much, Dr. Tinu. Thank you so much, Ibero, for taking out the time to come and answer our questions. also to come and educate us more. I mean, from now, I think she will not go and get the health insurance, even though she keeps saying she already has. But yeah,
No, keep saying this thing. I have.
I don't trust you. You don't fall sick for one, and you still, I mean, get it, if not for anything, for the wellness program and for the gym. So yes, at least now we now know the benefits of getting health insurance. So thank you everyone, and do have a good day, do have a great week, and even great weekend ahead. Thank you. Goodbye.